need to think of the vaccination is not just for the pediatrics age group. We have to think of the whole community. We have to think for the national immunization program covering the pediatrics. We need to think about the high-risk groups, elderlies. And we'll show you just some examples of what's the major value of these vaccines for these different groups. This is just to show you the current causes of mortality and death, and you can see differences between the poor quality and non-utilization. Actually, we mean by poor quality, I always try to avoid the quality. I try to use the term clinical quality. As you know, most of the quality actual accreditation in the region, they're based on different tools that are not really focused on the clinical indicators. How we diagnose the disease, how we treat the patient, what are the investigations, and what is the clinical outcomes for our measures. So I think the ones that can make a major difference in clinical care is the clinical quality rather than just general quality. And then the non-utilization. And the major issue related to vaccine non-utilization is the adult and high-risk group vaccination. If you look at the death preventable from public health interventions, and vaccine is one of them for the North Africa, Middle East, you see we have big numbers here actually. So much work can be done for our region. When you talk about vaccines from broad spectrum, we protect against morbidity, mortality, we reduce the disease severity, we discuss, for example, COPD bronchial asthma patients, we prevent the exacerbations, admission, complication, and also we have the post-exposure prophylaxis and prevention of long-term sequelae disabilities from different infections. In addition to the individual value of the vaccines, we have the societal and other benefits. We eradicate infectious diseases, we reduce the antimicrobial resistance, we increase the productivity, economic growth, and we have safe travel mobility, and also extended life expectancy. So we are talking not just about individuals, we are talking about the whole community from health and economic factors. So when we have kids vaccinating, we have, for example, healthier community, we have people live longer, and we have stronger economy. And actually, we have, during this pandemic, people are talking about, we have different opinions about different approaches, but the economy will not survive if we have poor health. This is why we have always to balance the health with the economy. So while we are talking about vaccines, some diseases we prevent complication, death, like meningococcal, we prevent admissions, complication, and mortality, like the pneumococcal vaccine. So for each vaccine, we can achieve different targets, either from the complication, long-term effect, mortality, and admission, hospitalization. So you can see the impact of different vaccines from reduction of hospitalization and mortality. So when we assess the impact of different vaccines, we have to look at the clinical evidence, economic evidence, and evidence from patient point of view. So we have to assess this one to make a decision for introduction of vaccines. For example, if we look at the influenza, there are major impact for the economic, some people are talking about the budget could be higher for some governments or some regions to introduce the flu vaccine within the national programs. And you can see the WHO developed certain models to show the cost effectiveness of the influenza vaccine for different groups and also for elderlies. When we assess the cost burden of the prevention through vaccines, we have to look at the direct medical cost and indirect medical cost. We have different things related to the visit to the emergency, to the outpatient, admissions, complication rate, mortality, and we have the sick leave, impact of the economy from work loss, and all other indirect costs. So all of them include them when we assess compare the clinical outcomes with the economic impacts. Actually, I'm really proud to see the studies that have come from Jordan. We have the rotavirus and hepatitis A, sorry. And I thank Dr. Wild, Dr. Kamel for achieving these studies over the last 3-4 years and the introduction of the rotavirus vaccine hepatitis A. I think You have provided a good example actually for others to follow in terms of the introduction of different vaccines or different medical interventions based on local data. The idea of showing you these studies, we actually, when I was based in the UK, there is nothing will be introduced within the national immunization program without having data on the incidence, complication rate, the economic evaluation, and you can see the number of studies for each vaccine. Unfortunately, in our region, we lack such data. We need much more work to do to assess the vaccines. We talked earlier today about the seroprevalence. There is a need for booster dose for measles, for example, or hepatitis B at certain ages, and there is a need for evidence. We are now trying to develop a local research group for vaccines in Jordan, in Tunisia, and Saudi Arabia, and hopefully we can look at the major areas of need research and try to act accordingly. But you can see that, for example, strep pneumonia vaccine, it will be introduced soon in Jordan. Still, we need much work to look at the distribution of different serotypes. We have some data from King Abdullah Hospital, but still we need more data from the country. The same for the other vaccines. So we encourage now to do more studies about RSV virus vaccine. We need to look also for varicella vaccine, other vaccines to look at the local evidence to support the case immunization. If you look at the introduction of strep pneumonia vaccine, how it affects the incidence of strep pneumonia, in a big way, you can see the major importance. Now, for example, if we look at the rotavirus vaccine, hopefully with the strep pneumonia vaccine in Jordan and the hepatitis A, and hopefully with the RSV, we can see that there is a major reduction of different infections incidence. It would be hopefully in the country, and this will lead to safer community, and also it will have impact on other things like the antimicrobial resistance. Here also another example for the influenza and the impact in the incidence and complication rate. Influenza, as you know, it used to have a major complication rate and long-term sequelae. Now it's controlled by the vaccine, and the same here for different vaccines. This morning, Dr. Adnan raised the fears with us about the vaccine hesitancy by the media leaks about the school vaccination of the COVID-19. We hope that things will be controlled soon, because when the MMR autism relation in the UK, it was like 10 years ago, it took them around 10 years actually to recover from that, because the hesitancy vaccine it became a major issue there. So we have to work together actually to reduce the vaccine hesitancy, because it can have major impact on the vaccine uptake. As you know that there is different efforts for eradication, like smallpox was eradicated. Polio, we are worried about it now, especially with the COVID-19 pandemic, but we should be always alert. Why do we need vaccines? As we know, if you leave the body by itself, it might recover, it might lead to disability or death, while the vaccine prepares the immune system to be ready for the vaccines. If the vaccine efficacy is high, we will not have disease, or at least will reduce the incidence. Vaccination, as we mentioned, it's not only for kids, it's for different age groups. We need it for different groups, and we'll discuss that in a minute. Just to skip through these slides, we ask sometimes for boosters, and we'll assess the immunity, especially for measles, rubella, because the impact during pregnancy is very severe, and also for hepatitis B, especially for high-risk groups. So we need to assess especially for vaccines, the booster dose. This is why, for example, during injuries, especially dirty wounds, we ask for toxoid vaccine. So we have to be aware about and educate the healthcare professionals and future medical doctors, the students, about the differences between live attenuated and activated and toxoid vaccines, so they can act in clinical practice according to these vaccines. The importance now, we are talking about kids back to school for COVID-19, because kids can spread the infection to others. And this is why in the States, actually, they tried to focus on influenza vaccine or elderlies, and the impact on incidence was not that high. When they introduced also for kids, they managed to reduce the incidence of influenza virus infections in a big way. So we have to think about kids as also, we want to protect them, but protecting kids also can protect other age groups at home. Alhamdulillah, last year, there was different epidemics of measles in the region, especially in Saudi Arabia, North Saudi Arabia. And we were worried about the situation in Jordan. This is the Alhamdulillah, we did not have any epidemics in Jordan from measles. This indicates the uptake rate of measles in Jordan was above 95%. This is a great example that the vaccine uptake was high in Jordan by the protection rate because of the high uptake of the vaccination. So we have always to be aware that when the uptake rate is not high, this will lead to the higher incidence of infections. Interruption vaccination program is serious because it will lead to increased incidence, and you can see here the example between Norway and Sweden, and this is why we were worried during the pandemic at the early stages about the continuity of vaccination program, and we thank the Minister of Health for having the program active throughout the pandemic. I'll skip these ones. We know that we need to protect different groups and pregnant women. We'll discuss that in a minute. My colleagues talked about herpes zoster and varicella, and we need to look at different infections, not just for the pediatric age groups. You can see the incidence of herpes zoster increase after the age 50, and this indicates that we need to consider the vaccination for those above the 50 within the national programs. We need to consider during pregnancy. Actually, some colleagues did studies on the on vaccination, like the flu vaccine during pregnancy in Riyadh, and they showed that women think some even healthcare professionals thought that the flu vaccine was contraindicated during pregnancy. And women also were thinking that it would be serious for the babies. So we have to increase education both among healthcare professionals and also among the community. And actually, the influenza vaccine, and we also thank the response of the Ministry of Health to the call of the NI-TAG about the introduction of flu vaccination, at least for this year, because there's different symptoms together. Also, to reduce the load on the healthcare system. And you can see we can reduce hospitalization by 21% by introduction of the flu vaccine, and we can reduce the mortality by this vaccine. The adult vaccination that we have been calling for over the last 2-3 years to be within the national programs in the region is not just a local issue, it's a global and matter as well. So we have to work in different directions in how we can sort the adult vaccination, and we know that there is different vaccine for different age groups and also for high-risk patients. So we have to consider them. If you look at for example, comparing COPD patient, asthmatic, smokers, chronic heart disease patient, you can see, for example, COPD patient, they have around 8 times higher than healthy adults in having the, for example, pneumonia infection. So we have to include this within their routine practice. So you can see this impact of flu, pneumonia, and other vaccines on these ones. I do encourage that to have the vaccination program integrated within the clinical guidelines for the high-risk group patients. For example, you are endocrinologist and you're in the crime practice, you have to include the vaccine indicated for diabetic patients. If you are a cardiologist, if you have patients with congestive heart failure, you have to include them. If you are a pediatrician having patients with cystic fibrosis, you have to include the vaccine. So it's very important to include these vaccines within the routine practice in your practice. So different factors that we have to consider on the vaccines, we have to consider risk benefit and to ensure the cost, the healthcare workers rule, and to discuss different factors when we assess the introduction of new vaccines. And we have also to face the perception belief about vaccination and to act according to that. And we always emphasize about the importance of healthcare professionals to ensure that their advice to their patient and the community is highly needed to ensure the high uptake of vaccines. My take-home message actually is repeating that we need to include the vaccination for the different high-risk groups, for elderlies, and we need to encourage pediatricians to include the different vaccines for patients at high risk, for example, according to their condition, cystic fibrosis patients with bronchial asthma, the same for adult patients according to their disease, and to include the vaccine within our routine practice for the high-risk groups and to have it routine for elderlies. Thank you very much.